It is estimated that between 1.8 and 5.8% of menstruating women have this diagnosis. Welcome back, Straight Talkers. Today I'm going to talk about premenstrual dysphoric disorder and how psychiatrists go about making this diagnosis clinically. Premenstrual dysphoric disorder is listed under the section Depressive Disorders in the DSM-5, and the essential features of premenstrual dysphoric disorder are mood and anxiety symptoms that repeatedly occur around the menstrual phase of a woman's cycle. We'll also see various other behavioral and physical symptoms, and these can lead to adverse effects on one's social and work functioning. And they go away around the onset of menses or shortly thereafter. When evaluating for this, there's 7 criteria that we take into consideration, and these are listed from A through G in the DSM-5. Criterion A states that in the majority of menstrual cycles, at least 5 symptoms must be present in the final week before the onset of menses. They start to improve within a few days after the onset of menses, and they become minimal or absent in the weeks post-menses. Criterion B states that one or more of the following 4 symptoms must be present. 1. Affective lability, and this can be demonstrated by someone having extreme mood swings, feelings of sudden sadness or tearfulness, or increased sensitivity to rejection. 2. Irritability or anger, or increased interpersonal conflicts. 3. Depressed mood, feelings of hopelessness, or self-depreciating thoughts. And 4. Anxiety, tension, and feelings of being keyed up or on edge. Criterion C states that one or more of the following 7 symptoms must additionally be present. 1. Decreased interest in usual activities, such as those that occur at work, at school, with friends, or with hobbies. 2. Subjective difficulty in concentration. 3. Lethargy, easy fatigability, or marked lack of energy. 4. Marked changes in appetite, and this can include overeating or having specific food cravings. 5. Hypersomnia or insomnia. 6. A sense of being overwhelmed or out of control. And 7. Physical symptoms such as breast tenderness or swelling, joint or muscle pain, or a sensation of being bloated or having the feeling of weight gain. So to recap, we need 1 symptom from Criterion B to be present and 1 symptom from Criterion C to be present. And when we take all the symptoms in combination from both criteria, there needs to be a total of 5 symptoms present. And if the symptoms from criteria A through C have been present for most menstrual cycles over the past year, I will then screen for criteria D through G. But first, make sure you hit that subscribe button so that you can be the first to know when new content comes out. Criterion D states that these symptoms are associated with clinically significant distress or interference with work, school, usual social activities, or relationships with others. Many people will tell me that they'll start to avoid going to various social events, which then leads to relationship difficulties with family or friends. Or they'll have decreased productivity while at work or at school. Criterion E states that the disturbance is not merely an exacerbation of the symptoms of another disorder, such as major depressive disorder, panic disorder, persistent depressive disorder, or a personality disorder. So Criterion F states that Criterion A should be confirmed by prospective daily ratings during at least 2 symptomatic cycles. And the way we go about doing this is by using a rating scale, such as a daily record of severity of problems for the diagnosis of premenstrual dysphoric disorder, which I included a link to in the video description below. Lastly, Criterion G states that the symptoms are not attributable to the physiological effects of a substance, such as drugs, alcohol, or medications, or to another medical condition, such as hyperthyroidism. Now head on over to the next video and find out more ways that you can live your best life.